What about in pregnancy? Obviously this is an important topic, and we haven't done definitive studies with probiotics proving that we can prevent preterm labor. But what we have done is a number of studies, and they're ongoing at the moment. They've been approved by Health Canada. We have a large study in Brazil which has been approved in pregnant women. And the design of the study is to, when someone gets bacterial vaginosis, we would treat them with lactobacilli and see if we can not only stop the infection but also prevent preterm labor. Because the way you get preterm labor is the infection, or and even an infection which you don't detect, so bacterial vaginosis often you don't detect, causes an inflammatory process in the vagina which leads to what we call COX-2 expression, and then that leads to prostaglandin release. Now, when it's week 40 and you're about to deliver, you want to have lots of prostaglandin, but you don't want that at week 24 or week 28. And so people are trying to understand what triggers that early process that leads to either miscarriage or a significantly early delivery of the baby. And so some of the studies we've done, for example, if you have bacterial vaginosis in pregnancy and you take Lactobacilli rhamnosus, GR1, and Lactobacillus reuteri, RC14, orally every day for, say, a month, does it have an effect? And there's a study in Poland which is going to be published this 2007, which showed in fact that you could correct bacterial vaginosis. So in 22 patients, they took GR1 and Lactobacillus reuteri RC14 for a month, and they showed that the pH, which is one of the indicators for bacterial vaginosis, went from abnormal back down to normal in the majority of the patients, so in 80% of the patients. So this is very exciting, and it suggests that you can in fact have a way of getting a pregnant woman back to normal. Now, we've also done what we call laboratory experiments. In the laboratory, you can test some of this where you're looking at inflammation. And inflammation is a problem in pregnancy because it can also lead to preterm labor. And the studies have shown that you can significantly reduce the inflammatory process by exposing the cells to Lactobacillus GR1. So that's exciting, but there's also another compound which we don't need to go into the name of it. It's PGDH, but that's a compound that you actually want more of it produced, because that can also help prevent preterm labor and continue a healthy fetus development. And in fact, studies which have been done in the University of Toronto have shown that you can increase production of PGDH with lactobacilli. Now, that might all sound technical, but the bottom line is, for a pregnant woman, it looks like it's safe to take the probiotic, and potentially if you have bacterial vaginosis, this might be a method of helping get you back to normal.